it would help us pull our demographic data together. That's my purview of the program. And how would that help me? How does it save money? It saves money tremendously because right now everything has to be done by phone calls and faxes, which requires staffing for both. I have to have an entire staff that's just set up just only to do referrals. I have several staff members that have to handle all the faxes that come off, send them to where they got to go, double check the data. And if we really want to stay on top of it, manually enter the fax information into our computer to set up ticklers to remind us, to remind when we need to check on something later. And when you don't have a manager sitting over the necks of every particular person working in that area, you don't know what's falling between the cracks, what's happening, until you get an irate call from a parent. I never heard back from these people that are supposedly you're sending me to or whatever, or they go there, well, they never ever sent me the information, and being to go back and try to find the documentation that this was done or was not done, it's a nightmare. I mean, it was a level of respect. It was a level of real true care, because obviously he would want to train the family to handle the problems that were maybe difficult but were within their purview to do. And he would come back for the more serious things, and which would allow him therefore to move other places. And having said all that, get connected, then that simply puts some responsibility back on me if I'm going to be really involved with the patient. If I'm connected with my pharmacist and he's connected with me, I can just tell you what we'll do just for asthma alone. We got, too many people dying from asthma. Some of this should never happen. We have patients who are having problems. They always show up with an acute attack. Well, I can see by being connected to my pharmacist, I can see, hey, I got this kid on inhaled steroid. It has so many inhalation puffs a day. It has so many puffs in the cylinder. We know exactly what it is, and it should last exactly 30 days. And I'm looking here, and I'm seeing this person hasn't gotten their medicine refill in 45 days. Well, I know they're what? They're not taking their medicine. With that information moving across my desk with connectivity, instead of wasting my time with nurses going to get faxes and the rest, I have somebody just reviewing that data. Telephone call hits out. I notice you're not taking your medicine. Are you having any symptomatology, any problems? What are you doing? Blah, blah. So it makes us now make the patient accountable. It makes them, I know this information about you. I see from your records that this isn't happening. But with the ability to see and move and know this information and get that, she was able to make these transactions because we care. And that's a part about being connected. It's showing that you really do care, and you're using your abilities to electronically check resources and use them.